Hey there, I'm Chris Duncan, and we're rolling out looking to provide the best Medicare videos on YouTube. I'm making this video in my hotel room at Caesars Palace in Las Vegas, and it was inspired by fellow University of Nevada, Las Vegas alumnus Guy Fieri, the host of popular show Diners, Drive-Ins, and Dives, and I stole that opening line from his show. Stay tuned to the end. I'll probably have another line that I steal from him as well. I graduated from UNLV like Guy before the last turn of the century, and I'm here on a working vacation. I have been by the pool preparing this and other videos I plan to shoot here in the room. While here in Las Vegas, I have also taken calls from those of you that have questions about Medicare, and I even signed a few of you up for your Medicare supplements, Medicare Advantage, and Part D plans. I'm always working no matter where I am. I love it. In this video, I'm going to be discussing what a Medicare excess charge is and how to look up to see which providers charge an excess charge, which providers don't, and which providers have opted out of accepting Medicare entirely. Hi, I'm Chris Duncan, independent insurance broker specializing in Medicare. If you're new to the channel or haven't done so already, please subscribe to our channel and hit the bell for notifications. That way you can stay up to date for new Medicare information and other informative videos like this one. To check Medicare supplement rates, go to our special site for this at MedicareRateQuote.com. You can also call us at 800-910-3382 with any questions, or you can visit our website, our main website at TrustedBenefitsDirect.com. Okay, let's get into it. Before we get into the details of Medicare excess charges, so everything makes sense as we go, there are some terms we need to know the definitions to. I will be providing the definitions in the description below, so don't worry about trying to write down the definitions as I talk about them. I get these definitions right from the official Medicare New Handbook, and a link to the 2020 handbook is provided below, or I get them straight from Medicare's website. I know a lot of you take notes from my videos. I know this because when you call asking questions, you tell me that you're referring to the notes you took while watching my videos, and everyone is so nice when they tell me that the videos I have made have really helped them understand Medicare, and I can't tell you how good that makes me feel. Yes, this is my job, and I do this for money, but I know you have a job or had a job for the same reasons. But what keeps you coming back is when people let you know how much that you've helped them. I know we all have jobs where we have to do it for the money, but what makes you feel good, or at least what makes me feel good, is I know I was able to help someone out, especially with Medicare, because it certainly can be so damn confusing, and these excess charges, they're not any different. Let's get into the definitions. First definition is excess charge, and I couldn't find a definition in the handbook, but the definition is in the glossary of Medicare.gov, and it states, if you have original Medicare, and the amount a doctor or other healthcare provider is legally permitted to charge is higher than the Medicare-approved amount, the difference is called an excess charge. In the handbook, it's actually referred to as a limiting charge and is on page 53. And the Medicare.gov glossary defines a limiting charge as, in original Medicare, the highest amount of money you can be charged for a covered service by doctors and other healthcare suppliers who don't accept assignment. The limiting charge is 15% over Medicare's approved amount. The limiting charge only applies to certain services and doesn't apply to supplies or equipment. I put this in here because I wanted you to know that excess or limiting charges don't apply to supplies or equipment. So now you need to know what assignment is, also referred to as Medicare assignment. And you need to know what Medicare approved amount is. We will start with Medicare approved amount, and this is in the handbook on page 115. Medicare approved amount in original Medicare, this is the amount a doctor or supplier that accepts an assignment can be paid. It may be less than the actual amount a doctor or supplier charges. Medicare pays part of this amount, and you're responsible for the difference. That takes us to the next term, assignment, also called Medicare assignment. Assignment is an agreement by your doctor, provider, or supplier to be paid directly by Medicare to accept the payment amount Medicare approves for the service and not to bill you for any more than the Medicare deductible and coinsurance. We now need to know the three different types of providers there are in the eyes of Medicare. There are participating providers, and in the second half of the video, I'm going to show you how you can use Medicare's websites to look up any provider that accepts Medicare and those that have opted out of Medicare. Next is a non-participating provider, and the third is private contract providers. This is all from page 53 and 54 of the 2020 Medicare New Handbook. The first type of provider I want to get out of the way is the private contract provider. You can look on page 54 of the Medicare New Handbook. Private contract providers are simple to understand. Private contract providers have opted out of accepting Medicare payments. On page 54, it states, what are private contracts? Certain doctors and other healthcare providers who don't want to engage with Medicare program may opt out of Medicare. You can still see these providers, but they must enter into a private contract with you unless you're in need of emergency or urgently needed care. Medicare won't pay for any services you get under a private contract, so you'll pay the provider's entire charge out of your own pocket. You and your provider will set up your own payment terms through the private contract. This also means if you have a Medicare supplement plan, it will not pay either. There is also a way to look up providers that have opted out. I wanted to get the private contract providers out of the way because they are the simplest. And by the way, less than 1% of providers actually opt out of accepting Medicare. Next, I will talk about non-participating providers, and they are by far the most difficult to understand, but if I've done my job, you will easily understand this by the end of the video. Now, you would think from the term non-participating that this type of provider or physician does not participate in Medicare, but they do participate in Medicare. They are non-participating when it comes to assignment or Medicare assignment. This means that these providers accept Medicare, but they don't accept Medicare assignment or the Medicare-approved amount as payment in full. Let's look a little deeper. If a provider does not accept Medicare assignment as full payment, then they can charge 95% of the Medicare-approved amount and also an additional 15% excess charge. Let's break this down with some actual numbers and this will become clearer. For example, if the Medicare-approved amount for a Medicare-covered Part B claim is $500, then a provider that does not accept assignment as full payment may charge 95% of the Medicare-approved amount. In this case, 95% of $500 is $475. Now, Medicare Part B will cover 80% of the $475 charge, and for this example, we are assuming the Medicare beneficiary has already satisfied their Part B deductible. 80% of $475 is $380. The Medicare beneficiary will be responsible for the other 20%, and again, we are assuming the Part B deductible has already been met in this case. The balance due for the Part B claim is $95 by the Medicare beneficiary. One of the reasons you are probably watching this video is you are interested in purchasing a Medicare supplement and are learning how Medicare and Medicare supplements work. 7 of the 12 Medicare supplement plans available to purchase will pay 100% of the Part B 20% coinsurance after the Part B deductible has been satisfied. The plans that don't pay 100% are Plan K, which will pay 50% of the Part B coinsurance. Plan L will pay 75% of the Part B coinsurance, and Plan N will pay 100% of the Part B coinsurance. However, with Plan N, if you have a certain type of doctor office visit, the Medicare beneficiary is subject to up to a $20 copayment and up to a $50 copayment for an emergency room visit when the ER visit did not result in an inpatient admission to the hospital. High deductible Plan F and G will also pay 100% of the Part B coinsurance, but only after a deductible has been met. The deductible on those plans for 2020 happens to be $2,340. You can get a quote on all the plans in your area through my website at MedicareRateQuote.com. Sorry for the break away from excess charges to Medicare supplements, but I felt that was important to know. So where does this excess charge come in? The non-participating provider may charge the Medicare beneficiary an additional 15% of the 95% of the Medicare-approved amount. In this case, the extra 15% is calculated on the $475, not the $500. If the non-participating provider charges the excess charge, and just because they are non-participating provider doesn't mean they actually have to charge the excess charge. But in this case, the excess charge is $71.25. That is 15% of $475. This $71.25 is the Medicare excess charge. There are technically 4 Medicare supplement plans that cover excess charges, and they are plans F, G, and also high deductible F and G. However, the excess charges will not be paid on the high deductible F and G until the deductible of $2,340 has been met. Let's recap quickly, as I know I've gone through it already, but I want to make sure it is clear. I graduated from UNLV, like I said, before the last turn of the century to be a history teacher, so I have a tendency to make sure everyone understands before moving on. In this example, the provider would receive a total of $546.25 for this service. The provider will receive $380 from Medicare. That's 80% of the $475. You will then be responsible, or your Medicare supplement will be responsible, to pay the doctor the remaining 20% balance of the $475, which is $95. The amount paid by your Medicare supplement, if you have one, will depend on which Medicare supplement plan that you choose. Now, because this is a non-participating provider, they are allowed to charge an additional 15% excess charge. The 15% is on the $475 and not on the $500, which is $71.25. Remember, because this is a non-participating provider, they can only charge 95% of the Medicare-approved amount. This is how the $546.25 totals. $380 from Medicare. The other $166.25 comes from the Medicare beneficiary through the 20% Part B coinsurance of $95 and the excess charge of $71.25, totaling $546.25. The 4 Medicare supplement plans that will pay the excess charges of $71.25 are Medicare Supplement Plan F and G. Also, plans high deductible F and G will pay, but only after the deductible has been met. Almost all of our Medicare supplement clients have Plan G or N, and we still have only a few that have Plan F. And not all states allow providers to charge excess charges. Providers in the states of Pennsylvania, Vermont, Connecticut, Ohio, Rhode Island, Minnesota, Massachusetts, and New York are not allowed to charge the excess charges. So if you see providers in these states, you don't have to worry about paying the excess charges. You also need to know this about non-participating providers. If you see a non-participating provider, then the provider may ask for payment up front from you. I take this again from Medicare New Handbook on page 53 of the 2020 version. You might have to pay the entire charge at the time of service. Your doctor, provider, or supplier is supposed to submit a claim to Medicare for any Medicare-covered services they provide to you. And then it says, if they don't submit the Medicare claim once you ask them to, you need to call 1-800-MEDICARE, which is also 800-633-4227. I have provided a link to the Medicare claim form below and a link to Medicare.gov's site about how to file a claim if needed. I found this interesting on this webpage. If your claims aren't filed in a timely way, 1, contact your doctor or supplier and ask them to file a claim. 2, if they don't file a claim, ask for the exact time limit for filing a Medicare claim for the service or supply you got. If it's close to the end of the time limit and your doctor or supplier still hasn't filed the claim, you should file the claim. Call us at 1-800-MEDICARE, not me, call Medicare, or which is also 800-633-4227. Now I want to talk about participating providers, and this is pretty easy, and you probably already have a good idea where this is going. I chose to put the hard part in the middle about non-participating providers so we could end this portion of the video with something easy before I showed you how you can look up to see providers that are participating, non-participating, and those that have opted out of Medicare. If you see a participating provider, they are not allowed to charge excess charges because they have agreed to accept Medicare assignment as payment in full. Now, about 96% of all participating and non-participating providers have decided to accept Medicare assignment. I don't want to take up more time citing articles about this, so I've provided links in the description to various articles that outline the percentages of providers participating, non-participating, and opting out. Now let's use another example, and we will use the same $500 Part B provider claim. This participating provider is going to get the $500 for this service, and that's it, because they have agreed to accept the Medicare-approved amount as payment in full. Because they agreed to Medicare assignment, they are allowed to charge the full Medicare-approved amount, unlike the non-participating provider that can charge 95% of the Medicare-approved amount, because they elected not to accept Medicare assignment as payment in full. Let's break this down. 80% of the $500 will come from Medicare. That is $400. The last 20%, again, we are assuming the Medicare beneficiary has already paid the Part B deductible. 20% of $500 is obviously $100. This $100 will come entirely from the Medicare beneficiary if they don't have a Medicare supplement, or depending on which Medicare supplement they have, the Medicare supplement can cover all of the 20% coinsurance. I really hope that made sense. If you have questions, please feel free to contact me. Now I'll show you how you can easily look up doctors that are participating, non-participating, and those that have opted out of Medicare through Medicare's websites. See you in a second. Okay, here we are on Medicare's website. This is at medicare.gov/physician-compare. This is where you can easily look up all providers that accept Medicare, both participating and non-participating providers. And we're going to start with Los Angeles just because there is a lot of providers in that area, and we'll use the generic last name here as Smith. You'll see some Smiths will come up here in clinicians, and then under specialties you'll see it's blank because there's no specialty called Smith, but I'll show you a little bit later how just to look up primary care doctors. So we're just going to look up, here we go, different providers with the last name of Smith located in Los Angeles. Now this is what we're looking for when we're looking for participating and non-participating providers. When we have a little green check mark here, this is a participating provider, and it says all physicians and other clinicians on Physician Compare treat people with Medicare. This clinician accepts the Medicare-approved amount as full payment for covered services, also called Medicare assignment, meaning you pay less out of pocket. You won't be billed for more than the Medicare deductible and coinsurance. So we know anybody who has a check mark, this is a participating Medicare provider. They accept Medicare-approved payments as payment in full. And we'll quickly scroll down and you'll see all of these providers that have them, that accept the Medicare-approved amount as payment in full. We'll go to the second page and you'll see all of these providers have the green check mark as well. And over 96% of providers accept assignment. They accept the Medicare-approved amount as payment in full until we get down to the very bottom of this second page for this chiropractic office. I want to show you the difference here. You'll see it has a red question mark on it. May accept Medicare-approved payment. And as we go over here to read, all physicians and other clinicians on Physician Compare treat people with Medicare. This clinician may accept the Medicare-approved amount as payment in full, as full payment for covered services called Medicare assignment, meaning you pay less. When a clinician accepts Medicare-approved payment amounts, you won't be billed, but this one may. So more than likely, this is a person or a provider that doesn't accept Medicare-approved amount as payment in full. They don't accept Medicare assignment as payment in full, and you can see the differences here. Here it says this clinician accepts the Medicare-approved amount, and then this one here says this clinician may accept Medicare-approved amount as payment in full. So more than likely, this person with the red check mark is going to be charging an excess charge. And as you can see as well, most of the providers, they don't charge excess charges, very few of them. Now we're going to take a second to look at how to look up providers that completely opt out of Medicare. And this link will be provided in the description below. And simply click here. This is going to give you a full list of all the providers that have opted out. We're not going to put in a name yet. Find opt-out provider. You can see they have 25,704 of them. And through here, you can just scroll through here. Not that you want to spend time doing this, but this is all the providers, 1 through 10 of the 25,704 that have opted out of Medicare. Now you want to say, well, what about a specific doctor? Let's go back to the change this, and we're going to use Smith again, and we're going to find the provider, and it's going to sort out everybody with the name Smith in it. And here's one named Andrew Smith for oral surgery, Greenwood Village, Colorado. They opt out of Medicare. Ashley Smith, clinical psychologist, opts out of Medicare in Overland Park, Kansas. Austin Smith and Lacey, Washington, oral surgery, they opt out of Medicare. So that's how you can find the ones that opt out. Let's go back over here to the Physician Compare. And let's actually go right back to the page as well. Physician Compare. So let's say you wanted to look up a primary care physician and you're in Philadelphia. So you pop in your city, wherever you are, Philadelphia, and now we're going to put in internal medicine, or at least part of it, and you'll see the clinicians with INTER is what I've searched right now, have popped up, but here are the specialties. You just click right here, internal medicine, to help find yourself a primary care physician, and here's how you do it. Very simple. So these are all the multiple specialists with internal medicine, which is primary care physicians. And if you want to find one that accepts Medicare assignment as payment in full, just look for the check marks. And then if you want to reconfirm it very easily, you can call them on their phone number right here, or whichever one that you're looking at. So as you can see, we'll just scroll through a couple of these, see if anybody, I haven't looked at this yet, see if any of these pop up with a question mark. See, almost everybody accepts Medicare assignment as payment in full. One more. And that's all I have to show you for this. Thanks again for watching, and we'll see you here on the other side. Hey, was that a crazy video about Medicare excess charges or what? But don't worry, I got plenty more videos about Medicare on my channel, and more Medicare videos are on the way. Again, I'm Chris Duncan, and I run an independent Medicare agency. We don't work for the insurance companies, we work for you, and all of our services are free. Because we are independent, we get to represent many different companies to make sure you make the exact right decision for your needs. We help with Medicare supplements, Medicare Advantage, Part D, final expense life insurance, and protecting retirees' retirement, and much more. It's easy to contact us. You can do so toll-free, 800-910-3382. Get a free Medicare supplement quote at MedicareRateQuote.com. You can fill out our contact form on our main website, TrustedBenefitsDirect.com. If you found this information helpful, please subscribe to our channel. Please make a comment. I'm always curious to learn what you think about this subject, or share it to your social media like Facebook and Twitter. We are always putting out information and important news and updates to help with things like Medicare Basics, Medicare Made Clear, Medicare Explained, Medicare 101, and much more. Thanks again, and I'll be looking for you next time.